Newton's first responders, along with schools and other departments, now carry the life-saving anti-overdose drug Narcan. The opioid epidemic is hitting communities across the country, and Newton is right there with them. Narcan is not to help cure addiction, but could save a life if there is an overdose.
For the past so many years, there's been an opioid crisis, not only in Massachusetts, but across the country.
Deaths related to prescription opioids have been increasing since the start of the 21st century. In an effort to combat the opioid crisis, people on the federal level, state level, and city level are looking for prevention, intervention, treatment, and recovery support methods to help people battling an opioid addiction. In the city of Newton, the mayor has commissioned an opioid task force to look at this crisis. The police officers, the fire department, schools, and the Department of Health and Human Services have all taken it in their hands to help the people of Newton.
Purdue Pharma produced a drug called Oxycontin, and here we are still battling the effects of that in the overprescribing of Oxycontin. So I think that that's really where the opiate addiction started.
When these folks have been prescribed these medications years ago now, there was never a way to get them off of it in a timely manner.
No one chooses to be addicted. After going in for surgery, even something as small as getting your wisdom teeth removed, doctors give patients painkillers that patients can get addicted to after consuming them for a period of time. However, those painkillers are expensive, so people then go to cheaper drugs like heroin to get their high, which can be extremely hazardous.
The heroin dealers, they're businessmen, and so they saw that they had a stronger product, cheaper.
Heroin is very cheap, but it's cut with many different things. It can be cut with fentanyl, strychnine's been found in it, rat poison has been found in it.
At the site of an overdose, rescue forces often use Narcan. It's the reversal of the opioid taken, so it counteracts whatever the person took by knocking the opioids off the neurotransmitters for 30 to 90 minutes. It can be administered through a nasal spray or through injection, similar to an EpiPen. In Newton, ambulance services and schools are equipped with Narcan. Just last week, the police and fire department reached an agreement to also carry Narcan.
It's imperative that it be accessible in everywhere, from housing developments to schools to, everybody should have access to it.
Narcan's always going to be part of any sort of opioid crisis because it's the reversant to the drug.
It's the first tool that might come out of the toolbox in a long road to recovery. They need somewhere to go, they need someone to go to after their involvement with us as a fire department ends to really affect long-term change.
More funding for treatment and recovery methods is required to get people the help they need and combat the opioid crisis. Newton police officers and the fire department urge you to be mindful of consuming prescription pain relievers and to get the help you need before it's too late.
Nobody wakes up and says, I want to be an opiate addict. Nobody wakes up and says, I want to be addicted to heroin.
We don't want to arrest our way out of certain problems. We would rather help somebody, get them treatment. That way they never get into the criminal justice system.
Angela Chow, Newton News, West Newton.